Hey guys, Dr. Brotsky here. It's week 15 of your pregnancy. If you haven't checked out the other videos, go ahead and do that. This week, your baby's about to start moving so much that you can feel it. So baby's already moving and growing so much, but you're gonna start to notice some exciting fetal movement here in the next few weeks. So that's just around the corner. Things you might be experiencing right now are some bad dreams. That's very common, actually. A lot of women come in complaining of very vivid dreams or bad dreams. This is very common just because of the hormone effects in pregnancy. So there's nothing wrong, there's nothing going on, but visit with your doctor if that's happening. There's not a whole lot we can do to change it, but be reassured that this is a common complaint. The other thing you might notice is that when you do have intercourse, you may have a little cramping afterwards. This is very common and normal for you to contract just a little bit after intercourse. Unless you're a high-risk patient, it's okay to continue. But if it's severe, definitely call your doctor. From a doctor's perspective around this time, your doctor might talk to you a little bit about skin changes, for example. There are many skin changes in pregnancy that can happen and that are very common. So your skin might start to darken a little bit, especially along the midline of your abdomen. That's very common. You might notice some darkening spots on your face as well. And a lot of people complain of very itchy skin in pregnancy. So it's very frustrating. One of the things that you can do to offset that is use some hypoallergenic lotions at the store. You can also do colloidal oatmeal baths. Try to avoid really hot showers as well, because that's just going to make it worse. It just feels better for a second and then you pay for it later. So just be aware of those things. And eczema type skin rashes are very common in pregnancy. So keep your doctor in the loop about that and ask what else you can do if those simple things don't work. So things you need to be doing around this time are maybe start investing in some pillows, because right around 16 weeks, you're gonna learn how to sleep more comfortably, like on your side. We always say the left side is what we prefer, but you can actually sleep on either side, and you can even sit at more of an angle. You don't have to totally be on your hip. You can actually just angle a little bit with something under your torso. So you might start getting a couple extra pillows. Some people go all out and get big maternity pillows, so whatever works for you. But around 16 weeks, we're going to ask you to start doing that. The other thing to keep in mind around this time is to keep being active, exercise, or continue doing so if you've done it before. If not, take walks around 3 times a week. This is super helpful and will keep you conditioned during pregnancy. The other thing to think about is making sure your meals are balanced and you're not listening to every one of those cravings. So that's it for week 15. Thank you guys so much for tuning in. I'll see you with the next video, but make sure you check all of them out on the same channel, and then you can always find me at drbrotsky.com.